here with Alex Pierce, and Alex is going to talk to us a little bit about golfer's elbow, which is on the inside of the arm, the medial epicondylitis. We've talked a lot about tennis elbow, the lateral epicondylitis. So a lot of it's related with the tendons, and Alex will share with us what he had to go through with his rehab after surgery and prior to surgery. Alex, appreciate you coming out.
No problem.
Tell us a little bit about what happened, what were some of the symptoms, and what you tried to do to help it.
Okay, well, about 6 years ago, I started to, started sustaining some pain. It was continuous, and I thought at first it was just, normal overuse and that kind of thing. And so I started using the usual therapies, ice, rest, that kind of thing, even massage.
Right.
And none of that seemed to work, and it just went on, and I would play a little bit, and then hurt some more, and then hurt some more, and then finally I went to a doctor and saw a GP at first, and then went to a regular guy and an ortho guy, and he said, okay, do some physical therapy. And I went through, I think that was maybe 5 years ago, and I went through my first series of physical therapies and exercises. Usual thing, shoulder strengthening, focusing on the small muscles, try to strengthen things around it. All the usuals. That didn't seem to work. It would feel better for a little while. Yeah, cortisone shots came later, much later. I actually didn't want to do them initially at all. But then about 3 years ago, I did the cortisone shots. I did 3 series of those over maybe a 4-month, 5-month period, because you have to wait a little bit in between shots. And then essentially went more physical therapy, tried everything, even acupuncture. And the acupuncture actually told me, he said, hey, look, if 3 treatments don't work, it doesn't work. You need something more. And then I went back and saw another friend who suggested a surgeon. I was in Colorado Springs. I saw the surgeon for the USOC, one of them there, and he went in and took care of it. He described it as you would a ruffled feather. If you took a feather and pulled it back in reverse. They cut it down to clean tendon, and then they resected the nerve and stitched me back up. And about 9 months later, after more physical therapy and the usual rest, it's been pretty good since then.
Right. You're about a 4 or 5 player.
Yeah. Yeah.
So you when you play now, you're hitting against guys who have a lot of pace. So
yes.
Your golfer's elbow was on the medial epicondylitis was on the inside.
Exactly.
So is there pain still? Do you have pain when you play, or?
It's not perfect, but the pain is not so debilitating where you have to stop. And generally what I do now, getting a little older, what I do is I rest a day in between playing. I try to keep it to 3 sets, not go nuts.
Now, was that the doctor's suggestions, or is that just what you feel?
It's just life. Yeah, it just seems to me like it's what's necessary. And I still do massage therapy, about once a month.
Right.
Stretching. I do bands.
Yep.
Ice. I mean, just normal things if I feel I've exerted it.
Right.
That kind of
So
thing.
you probably play twice a week, 3 times?
Two to three to most. Yeah.
And you'll feel a little bit of pain, but
not much. Yeah.
Okay.
Yeah. Nothing where you can't function. Just
Right. But there's no way you could have played prior to the surgery.
None. No. Absolutely no way. No. I was done. In fact, I couldn't do many things around the house.
Really?
Period.
Yard work?
Nothing. Yeah.
Wow.
It was just anything that was heavy, and I had to use that outside edge, to where this part's where you're coming in like this.
Correct.
Yes, you were done.
Wow. And you tried physical therapy. You tried everything before surgery. Surgery was the last.
Right. And on top of that, I'm already on a regimen of pain meds, so it didn't even make any difference. I have bad knees.
Sure.
So I take like Mobic, which is an anti-inflammatory. I take tramadol for pain. These are daily meds.
Wow.
These are maintenance drugs, and they, the pain was still overwhelming.
Wow.
So, yeah,
it's
pretty tough.
It's basically the same as tennis elbow golfers. It's all revolves around the tendon.
Right.
And you're putting so much pressure, and yours was so bad that it was.
Right. The inflammation is just so severe that you can't really do anything, especially tennis related, because it's just so demanding.
Right.
Especially on serves, forehands, things of that nature.
Now,
forehand volleys, the worst.
When you hit for golf.
Yeah, because it's inside,
right.
so it's just brutal.
Now, did they during surgery? Did they actually take the tendon, detach it from the bone, or?
No, it was not severed from the bone. What they had to do was just basically because it's so shredded, They basically have to cut it back until they get to good, fresh,
Gotcha. Yes.
nice new blood and everything else. And then there's an actual term for it. Forgive me, I can't remember the actual surgical term, but the debridement, or whatever it's called, debridement of it is necessary.
So pretty much a lack of blood and oxygen getting to that part of the tendon.
To some
So
degree,
when it's
yeah.
fresh,
Plus, it's also so swollen and shredded that it's agitated, constantly on the bone,
Wow.
so.
And also, we understand that the nerve runs on the inside of the arm.
Right.
They
They had to,
relocate that.
yeah, they had to resect that and put it in a different direction because of the way it was rubbing up against that area where it was inflamed. Now, over the years, your elbows, knees, the arthritis and everything else.
We all age. We all
Yeah, you get a little something, so you got to smooth out the spots. But it's a difficult condition.
But hey, a year later and you're playing good tennis.
Yeah, after 6 years of pain, yeah.
Well,
But it's fun.
I guess that'll help with that answers some of the questions I'm sure a lot of people out there have about tennis elbow and should I get surgery? When should I get surgery? Obviously, Alex waited till the very last minute to do it, and as you see, he's back playing good tennis. So we appreciate you coming out.
Not a problem.
Talking about it.